Good morning, everybody. Welcome to the Thursday edition of Video Clips. And a couple things. First of all, I did a video clip not too long ago on single-payer systems and got a lot of response from you guys on healthcare costs and controlling healthcare costs. So I've chosen to write some newsletter articles about that. I started a series last week. And so if you're not a subscriber to the newsletter and you want to become a subscriber, I'll send you the articles that have already appeared and add you to the subscription list so you can see those articles. They're different than the ones I cover in video clips, all right? I want to start by answering a question that I've gotten from a few people. For whatever reason, this question came up about 4 times in emails or comments on my YouTube channel. So here goes. Dr. Pam, your website doesn't say a lot about diet and lifestyle change and instead talks a lot about education and informed decision making and all these other things. And so I'm just wondering, does this mean that you don't focus on diet and lifestyle, or don't you think diet is important, or where does it fit in, and all that sort of thing? And I think that's a really legitimate question. So I'm going to answer it here instead of emailing back to some of you individually. So here's the thing with informed decision making. First of all, health is bigger than just the diet you eat. And so I think it is a reductionist fantasy to think that the complicated people who have had lots of medical intervention are just going to change their diet and all their problems go away. So the first thing is that's why we focus on whole person health, which means not just what you're eating, but your exercise patterns. Are you sleeping well? Are you over-tested, over-treated, over-diagnosed? We deal with this stuff in educational programs, of course, but it's more than just diet. But the second thing is that informed medical decision making often leads people to become much more enthusiastic about diet and lifestyle change than they might have been. And one of the reasons is when they start getting good objective information about medical care, they find out that some of it, maybe a lot of it, is not very effective. They just didn't know it. So for example, when reviewing about evidence about the best way to lower plasma cholesterol levels, people are often shocked to find out that drugs reduce the risk of, the statin drugs reduce the risk of heart attack, stroke, and all-cause mortality by about 1.2, 1.6%, less than 2%. There aren't any of them that are better than that. Well, information like this can provide pretty powerful motivation for people to change their habits in meaningful ways. And if you take the step further to show what the evidence reports, what published studies report about the effect of diet on plasma cholesterol levels, you often have somebody who says, you know what, I think based on what I've seen, I think probably I should give that diet a try because certainly the statin drugs are not as protective as I thought they were. The same thing is true for type 2 diabetes. I mean, the package insert for metformin reveals that the drug causes weight gain, and if you keep gaining weight, you'll probably end up being an insulin-dependent type 2 diabetic, all right? On the other hand, if we look at studies with diet and type 2 diabetes, we find that even insulin-dependent diabetics are often able to discontinue their medication within 3 weeks. Now, the decision has to be up to the patient, but I think you get my point. Motivated people when they see that the diabetes drugs are not as effective as they thought. Now, a lot of people discuss how hard it is to get people to adopt and stick with better habits, and there are a lot of reasons for it, but one of the reasons is that people are not aware of the limitations of traditional medical care. They think they're safe because they're receiving the best medical care available. We've been pretty successful in getting people to work at improving their health with habit change by using informed medical decision making. In fact, when working at employer sites, we're almost always able to get over 50% of the population to voluntarily enroll in programs without any financial or other incentives provided by either us or the employer itself. And that in itself is pretty remarkable when you think about it. If you look at these insurance company programs, they almost always have, you get a free gas card if you do this, you get a gift certificate if you do that, you get paid time off. I mean, the bribery that goes on just to get people to do something is amazing, and we take all that off the table, and we get people to do this on the merits of the information we put in front of them. So people who are fully informed make better choices, and those better choices usually involve diet and lifestyle habits, and that's the answer to the question. And for those of you who, I think there are many types of people who watch these videos, but first as health professionals, you're trying to get people to do better for themselves. I think you'd be well advised to use this approach. We have great libraries, we have lots of resources here if you want an affiliate relationship with us or you want to train with us. We have people who just care about other people. You want to get your friends and family on board to take better care of themselves. It's a better approach. And as a consumer, you can learn about this so that you can be more effective when you talk to people. And then we have people who are wondering, what the heck am I going to do about my own health situation? And I hope that these videos and other information that we provide start to get you thinking about the importance of looking at options and factual information before you make decisions about what you're going to eat, the supplements you're going to take, and all that sort of thing. All right, this I'm so excited about. I can't believe it. I get all these news feeds about medical studies, and I read a lot of medical journals, and my job allows me, and I mean it allows me to do a lot of research because I really love doing that. I'm very spoiled. I have a job that I look forward to every week. And so I found this article on breathing and reflux. All right, so here's the deal. In addition to causing significant side effects, proton pump inhibitors are not effective much of the time. PPI, refractory gastroesophageal reflux, or reflux that doesn't respond to drugs. How's that for a much better English explanation for it? Affects about 30% of the patients who have GERD. Almost half of these patients report that continual belching is a problem. And belching is not only a symptom of GERD, but it increases the number and severity of reflux episodes. Well, a recent study showed that breathing exercises improved both belching and symptoms in patients who were resistant to drug treatment who have GERD. The study included patients who'd been diagnosed with GERD who also reported belching, heartburn, and/or regurgitation even after taking PPIs daily for 12 weeks. 15 patients were taught a standardized diaphragmatic breathing exercise protocol, while 21 controls were placed on a wait list. All of the subjects completed questionnaires at the start of the study, after breathing therapy, and then 4 months after therapy ended. The 21 control patients completed an additional questionnaire after their waitlist period, and they eventually got the breathing treatment too. During the intervention period, 80% of the patients who were taught better breathing techniques had significant reductions in belching frequency as compared to only 19% of the controls. Intervention patients also reported significantly greater reductions in reflux symptoms and more improvement in quality of life than the controls. And interestingly enough, the patients who had the worst symptoms at the start of the study showed the most improvement, and the positive changes were sustained 4 months after the training sessions ended. Now, the method of breathing used for this intervention was diaphragmatic breathing. Diaphragmatic breathing is the method that was used, and anybody can learn it. It's defined as deep breathing that involves contraction of the diaphragm, the muscle located at the base of the lungs. There are hundreds of online videos that demonstrate the practice. And so you just place one hand on your upper chest and the other on your belly just below the rib cage. Breathe in slowly and deeply through your nose while your chest remains relatively still and your belly rises. Your rib cage will probably expand a little bit as well. Then exhale through your mouth while contracting the abdominal muscles, and then the belly will return to its original position. Now, I decided after I read this article that what I would do is see if there were any other articles in the medical journals that showed that this could also be helpful for other conditions. And lo and behold, I found that it is. This type of breathing can slow the heartbeat, lower blood pressure, and reduce stress and anxiety, and can help patients with COPD who generally have weaker diaphragms to take in more air with less effort. And it strengthens the diaphragm. Eventually, COPD patients can get better if they use this particular breathing technique. One thing just to keep in mind, with your own breathing, I mean, you may not have any of these conditions, but it's a good idea to learn this type of deep breathing because most people become shallow breathers, which means that they use the upper chest to breathe. This results in overuse of muscles in the back of the neck, in the upper body and in the neck, and underuse of the diaphragm. Shallow breathing is usually practiced particularly in stressful situations. It gets a lot worse, and then it makes the stress even worse. Like if you're stressed out and you start shallow breathing, it exacerbates the anxiety that you're feeling, which makes the shallow breathing worse, which exacerbates the anxiety. That's one of the things that contributes to people having anxiety attacks. They literally somewhat work themselves into a frenzy with the shallow breathing, and it results in more anxiety. Regular practice can make this deep breathing a more energizing and restorative form of breathing, the default method. And one good way to get practice at this is taking yoga classes, which almost always involve a focus on breathing, specifically this type of breathing. So I remember when I started taking yoga classes a long, long time ago, I was a shallow breather. I didn't know I was a shallow breather at the time, by the way, and a lot of you probably don't know it either. But the more I came to yoga, the first thing was that I got to the place where I didn't have to be reminded to breathe deeply in yoga. And then the next thing I noticed is I was breathing differently when I wasn't in yoga. And I really cannot remember the last time, it's been so long ago, that I did that shallow breathing that just exacerbates whatever stressful symptoms you're having at the moment. So here's the thing. I don't think many of us think much about breathing. We really couldn't, because we have to do it, right? So if all day long you had to think about breathing in order to make it happen, you'd be so distracted you couldn't get anything done. But better breathing techniques can improve your health in many, many ways. They actually can be used as treatment for disease, as I just mentioned, but also just improve your general health. You're calmer, more relaxed. You're able to calm yourself. That's another thing too, is I haven't had to do this for a long, long time either, but I remember when I started being able to calm myself down when I got upset about something just by breathing differently. So try it. If you haven't been to yoga yet, I strongly encourage it. I think it's a great practice, and I don't know anybody who's a regular practitioner who won't tell you that it hasn't changed their life in significant ways. All right, that's all for today and all for the week. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you next week with more news.